Hello, I'm Vesna Golic, Deputy Director of Common Threads Project, and today I'm talking with one of our team members, Dr. Adeyinka Akinsulure-Smith, very essential for development of our Common Threads Project methodology, healing circles, training of our facilitators, and now also facilitating a group at the Program for Survivors of Torture at the Bellevue hospitals. Can you tell us more about how does it feel and what it is like for you to facilitate a healing circle of Common Threads Project?
I have to say it was an exciting notion to me. Um, you know, First of all, having worked with women who have experienced gender-based violence for many moons, having this group setting, but not only a group setting and format, but one that actually incorporated into the group approach specific elements, elements around art, elements around the body, what was a way of doing group that I had not previously done. So learning the techniques, learning common threads, and then being able to apply it was really quite exciting to me.
How does this work compare and fit into your regular work with your clients at the PSOT?
I mean, it's a different kind of group. At the Program for Survivors of Torture, we've always used group as the group format as a type of intervention. We have, for example, I have a men speaking English group. We have a Francophone group. We have a group for Tibetans. We have a sexual orientation group. But to have a group where we are moving from just the cerebral, just the talking, the speaking, to incorporating into it integral pieces of art, of other techniques, of breathing, of body, is a very new thing for us at the program. So it definitely represents a shift in our approach to treatment.
How would you compare the impact on the people who you're working with when you apply this Common Threads Project methodology and the other work that you're doing?
I think one of the things I really liked about this approach was in the group format, again, getting away from just the talking to giving clients actual specific techniques that they could go away and use. For example, specific grounding techniques, ways in which we engage the group members. It felt like it moved from merely being a supportive group setting to actually being a little more action oriented. And that, again, was something new within a group format for me.
You normally work with people who are in displacement and have experienced trauma. And this group of Common Threads Project is a group of women with specific trauma and also in displacement.
Mm-hmm.
What does it mean for people to be in a group when they're in displacement? How does that influence their life?
So in our program, we're working with people who are forced migrants. And by that, I'm talking about asylum seekers, asylees, refugees, and some undocumented people. Specifically, for people who have had these experiences, there are many losses that they have gone through in addition to their traumas. So one of the big losses is that loss of a sense of community. And the group format, this is something that it allows for, and that we saw really evolve beautifully in the group that we did, where this building the sense of trust among the women, building a sense of community, if you will, a sense of family, a sense of sisterhood, became a really key part, I think, that was expressed for all the women who were in the group.
And a part of the work is what we find in many cultures, stitching as a way of women being together in that group that you just described,
Mm-hmm.
building the sense of community and also healing. Can you reflect a little bit on the story cloths making and stitching as a methodology?
So the women in our group, they were few, ran through a range of experiences. Some had never had experiences with stitching or sewing. Others had had more experience. So, it was a process of learning together, learning from each other, and then creating the works. In our groups, we didn't finish. It happened that we didn't finish the story cloths completely, but the idea was that they would continue to work on them. But really beginning to put out their experiences, projecting them on the cloths, being together as they worked on them and learning from each other became an integral part of that healing process.
So just to conclude, this methodology, from what I'm hearing from you, has three main parts here, or three main effects. One is building the group and building the sense of community for the women, which is important in their displacement. Another one is learning the techniques that can help them manage their trauma and the symptoms of trauma. And the third is really this stitching process that complements this other ways of healing and brings it to another level. Is there anything that you would want to say at this point that I didn't ask?
I think the extent of the sense of community that was built was reflected in, the women's reactions to the ending. And so it wasn't just that they were building connections and community to them among themselves, but also to the facilitators. So there was a real sense of, an additional sense of more loss about the ending of the group and about the ending of their relationships with the facilitators.
Finally, as a facilitator, how were you impacted?
Learning new skills actually, in terms of the techniques, learning to begin to think about incorporating, artwork. Um, some of the activities we did that I had not thought about using, that now I can see ways in which I can actually incorporate them into the individual work I do with some of my patients slash clients at PSOT. So, a lot of learning going both ways.
And what would you like to do next now that you have this experience?
Well, our hope is actually to start another circle. There were a lot of lessons learned working with this population. My hope is that we'll take the lessons learned and apply them to the next circle.